Doc, how did you get started from being an adult PhD in adult and organizational psychology back in 1987 to this integration of putting light on someone's head?
Well, it was a bit of a circular route, but we started out with my having an interest in how people learn from their own experience, and also a real focus on the mind-body, how the mind and body work together. And so while I was doing my doctorate, I also did a concurrent clinical training program in psychoanalytic psychotherapy that had a basic body orientation. It's called bioenergetic analysis. And so I was focused on how body and mind work together. And one of the things that led to was my being in private practice and focusing on how people's physical experience correlated with their psychological difficulties and the things that they came to work on in therapy. Well, one of the people that I started working with came in and started talking about how sometimes things don't click. And he literally did this. And I said, what does that mean in English? And he said, well, I have to read things 2 and 3 times because I can't stop the letters from moving around on the page. And it's really hard to keep things in mind sometimes and remember things. And I offhandedly said, what, you got hit in the head? And the guy said, oh, I never had a car accident. And I said, well, wait, that's not really what I asked you. And one thing led to another, and he started to tell me about his head injury history. And that made me step back and start wondering how many other people I'd been working with who had head trauma. Well, it turned out it was fully 70% of my practice. So I had to go back and start really looking at how does actual brain injury and brain trauma influence the development of certain kinds of psychological disorders. And that led me to exploring biofeedback as a way to address those underlying neurophysiological challenges that people were experiencing. While I was doing that, I learned about a study that had been published in the British Journal of Neuroscience by Paul Chazot and Dr. Gordon Dougal, and that had to do with the use of infrared light as a way to reverse dementia in an animal model. The person I was working with was able to pay for Dr. Dougal to bring his technology to Pennsylvania, and we used it with this guy's wife. And what we found was that by this person using the photobiomodulation of 1,068 nanometer infrared light on her head twice a day for 6 minutes, we saw a really dramatic improvement in her primary progressive aphasia symptoms in a matter of about 3 weeks. Now, I had been doing biofeedback with this person for about 3 or 4 months, and we'd seen some progress. But then once she started using the infrared light and we combined it with the biofeedback, her progress accelerated dramatically.
Wow. So you're taking so as you're a psychologist? What, you're a psychologist?
I was a psychologist and practiced as a psychologist until about 2010. And then I focus primarily now on my research practice.
But what I say is that you kind of took a physical approach to the mind. I mean, and so that's kind of led you into also using physical modalities, if you will, or external processes. It wasn't a talk cure only for you.
No, we were focused on, my focus was very much rooted in psychodynamic and psychoanalytic theory from a Freudian, neo-Freudian perspective, but it was mainly based in the work of Wilhelm Reich. And Reich was the person who developed the theory of character analysis and character pathology. And what he basically was saying is that all intrapsychic conflicts have a corollary in patterns of chronic muscular tension. And so we were trained to look at how people were manifesting their psychological difficulties, their tensions, their neuroses, if you will, as in their body and in their physical movement, in their voice, in their way they conducted themselves and moved through space. We were very attentive to that and commented and worked with them to increase flexibility and release the patterns of chronic tension. And when we did, we found that it was a lot easier for those people to work through the early traumas and become more flexible in the way they responded in their life.
Beautiful, beautiful. So you saw it. You saw it.
It was direct. Yeah, it was a direct thing. But when we saw that there were actual patterns of trauma, of physiological injury to the brain, well, then that no longer allows us to think that we're going to be able to resolve those kinds of injuries or those kinds of traumas using talk therapy or even physical exercises and expressive exercises. Something else needed to be used in order to directly intervene at the level of the central nervous system. And that's where the biofeedback came in.
And so in your arsenal, you've put things that can change the brain.
Directly, yes.
Directly.
But we were interested in non-invasive. We were looking at non-invasive, non-drug options so that they were congruent with the way in which we were conducting psychotherapy.
Perfect. Well, do you want to go to the slides?
Sure. Now, you're not going to read all the slides. So our work at the foundation primarily now is focused on how we can integrate the use of photobiomodulation with quantitative EEG-based neurofeedback or brainwave biofeedback training along with functional medicine. And so our agenda is primarily to support the repair and the regrowth and the retraining of brain activity in the central nervous system. So what I'd like to talk about is going to be some background on memory loss, how photobiomodulation improves cerebral blood flow, what we think of as an optimal treatment approach, and then how our pilot clinical trials have been conducted, and then to give you an outline of a particular patient that we worked with over a long period of time. And then I want to add just a comment on how photobiomodulation could be useful now in the treatment of COVID-19. So when we talk about memory loss, the different kinds of memory loss are apparent in that we talk about short-term sensory working memory and long-term memory loss. And the process that we're looking at is how do we then address treatment of that from a systemic point of view. And we know that dementia affects all sorts of aspects of social functioning and behavioral functioning. And here we have different cognitive changes and psychological changes that occur in the course of people becoming involved in dementia. When we're talking about the process of dementia, we think about it in terms of the two basic problems, one having to do with hypoperfusion and the other having to do with the increase in inflammation. And we've seen that photobiomodulation is an intervention that can positively address both of those problems. So when we think about memory loss and how to treat it, we really think along the lines of what Dale Bredesen and the people involved in functional medicine are doing now in terms of recognizing that dementia and memory loss are really a systemic disorder and that they're multi-determined, and that what we're doing is addressing certain aspects of that systemic problem and using photobiomodulation as a way to improve functioning in certain areas, but not all. So the two areas that we are particularly interested in have to do with blood flow and perfusion and the reduction of inflammation as primary effects of photobiomodulation treatment. So we think along the lines that it's really about blood supply rather than demand, and that it's really been shown that photobiomodulation increases cerebral blood flow. And we also know that it increases, that the exposure to infrared light increases cell viability and protects it against ultraviolet exposure. That was one of the research studies that got me particularly interested in photobiomodulation. So we know that infrared light exposure can be a therapeutic intervention from at least two perspectives. It can help increase blood flow, preventing neurodegeneration, and also increasing cell viability and therefore resistance to injury. The specific spectrum of light that we're using in our research is 1068 nanometers, and also with the V-light, 810 nanometers. These are both light sources that are being pulsed at 10 hertz. And this is the near infrared light spectrum, which in this slide is infrared A.
And what's the key there? The key is higher frequencies and equals shorter wavelength and more energy delivered.
Right.
So
right.
A frequency is the 760 to 1000 is a higher frequency wavelength of light. Higher frequency, so a shorter wavelength because it's making more turns, and that's telling you.
Yeah, and it's delivering more energy to the tissue,
right.
And the fact that it's pulsed has the effect of increasing the depth of penetration. In terms of penetration, there were studies done at the University of Bristol that showed how much light gets through to the cortex, and that's what this slide is from, is just showing that about 5 to 10% of the light being generated at the scalp surface is actually making it down into the cortex. This is a slide that just shows the molecular biology of apoptosis and how infrared light influences a reduction in apoptosis by stimulating the production of specific heat shock proteins that mitigate against cell death.
Yep, this is a lot of good stuff here, and Paul Shahzad is going to go over that very, very, very well.
This is just indicating the different directions in which you would deliver light therapy so that you can influence different conditions. So with dementia symptoms, you would deliver it transcranially, whereas with Parkinson's, you want to focus primarily temporally and also at the foraminal notch in the back and the occipital area of the head. So when we talked about what would be an optimal treatment approach, what we came to was that we want to accomplish at least 5 things. We want to be producing an intervention that's going to increase neuroprotection, that's also going to improve regeneration, that's going to prevent toxic accumulation of proteins, and that's also going to help with the production and regulation of specific neurotransmitters, and then to improve and renormalize neuronal connectivity, and that being accomplished with the brainwave biofeedback training. Now, this is a slide that's taken, that I made a list of the 35 holes in the roof that Dale Bredesen talks about as being precursors or conditions that can cause and contribute to the development of dementia. And what I did was put an X next to those particular factors that have data supporting the fact that photobiomodulation can significantly improve those particular causal problems. So fully a third of the holes in the roof, as Bredesen refers to it, can be addressed by photobiomodulation therapy alone.
Targeted tissue activity, like you said.
Right. This is the device that we've been using in our therapy and in our research, and it uses about 1,100 LEDs, all matched to 1,068 nanometers. And you can see that it does transcranial and intraocular stimulation. The V-Light, on the other hand, has 4 diodes that are targeted toward, in the standard procedure, toward the default mode network, and they're delivering about 475 milliwatts of power throughout the 4 diodes. The Cognito light is probably about 600 milliwatts. So we know that these are the different approaches to treatment that have been shown to be effective. These are the different treatment conditions that have been effectively used. Wow. Photobiomodulation has been used effectively to address these conditions.
Mm-hmm. That's a lot of good stuff there. Chemo brain, things that we talked about a lot of these.
The trial that we've been doing at Baylor Scott and White, which is in Temple, Texas, through the Department of Neurosurgery, involved the use of the Cognito light, and people were given a quantitative EEG and a full neuropsych battery, and then given the device to take home.
Mm-hmm.
And they used the device twice a day for 6 minutes each, and then they came back for post-testing after 28 days. The findings were that the Mini-Mental Status Score went up 3 points after 28 days in a significant portion of the subjects, which is significant at 0.05. The significance of the improvement in clock drawing was one of the things that we found most compelling as a piece of data, because you can see that the quality of the clock drawing before and after treatment is significantly improved.
That looks really good.
Here we go. So the immediate word recall and was over 60% improvement. You can see that delayed recall and detailed logical memory improved significantly, and there was almost 100% improvement in the long-term memory, which is in fact not that surprising, because long-term memory is one of the last functions that people lose as they progress in dementia.
So these were in your neuropsychological assessments before and after the 28 days.
Right.
These are the types of changes that you saw in the memory activity.
Right.
And if I go back to this one, this was a motor function of the clock drawing and memory.
It's certainly motor, but it's overall executive functioning, praxis memory. I mean, this covers a number of different dimensions of neurocognitive functioning.
And then this one was the total just mental many state exam. So
right. So that's just
function,
yeah, go ahead.
Cognitive function and memory were showing some very noticeable improvements in the 28 days.
Right. Here we're just looking at quantitative EEG, which is a recording of 19 independent channels of EEG activity all over the scalp, and then comparing it using a normative database by age, gender, and handedness to see what kind of changes are taking place. And what we can see in those areas of red and blue, those red would be overactivity, blue would be underactivity. And what we can see is that there wasn't any particular area that showed significant change in the group using the placebo device.
Wow, that's very distinct.
However, with the group that was in active treatment, you can see that there was a almost complete normalization of relative EEG activity between the pre-test and the post-test in the delta region. and also a normalization of alpha activity as well. And what we can see is that the treatment now kind of went over activity in the higher beta region. So you're seeing excessive activity now in higher beta that would be something we would focus on if we were doing brain biofeedback. We would then work with the person on decreasing that area, and that would further help to normalize their overall cognitive functioning. So they kind of went from underactive to overactive, and now it's a matter of trying to find that happy medium. We can also see that there was a significant improvement in the fourth row that has to do with coherence, which is actually the correlation coefficient between different pairs of electrodes. And what we can see is that in the delta and in the theta, there were significant reductions in the hypocoherence, which is another way of putting that is the disconnectedness of the different brain areas are now coming back into functioning more coherently, and that again contributes to the person's improved neurocognitive functioning.
So
you can also see
the finding of the increase in the high beta is still something that you notice. It's a reaction. So
oh yeah,
it is having an effect. You know, it's doesn't necessarily know if that's going to be, you know, if they're getting smarter, they're getting more cognition, they're getting brighter, their memory's coming up. Maybe these areas needed a boost, you know, maybe they had to go higher. And
well, in a sense, yeah, I mean, in a sense, the issue is that the person's brain has become significantly dysregulated. And the dysregulation can be best understood as them losing their ability to efficiently discriminate how much of a reaction any particular stimulus deserves or warrants. So because there's this loss of capacity to respond efficiently, you're going to see more underreaction and extreme overreaction as people begin to respond better. So this dysregulation has to be addressed by increasing the person's ability to make better and better discriminations between how much reaction or how much energy or response any particular stimulus deserves.
And then you could control that with the neurobiofeedback. Is what
that's the primary focus of the biofeedback, is to produce that improved regulation. And here you can see it in the NeuroNavigator display, which is a more refined display of the EEG activity that we were just looking at. And what you can see is that there is a significant increase in activity, particularly in the cerebellum. And we're thinking that this is going to become a very important area of future research where we can then begin to do neurofeedback training of specific areas of the cerebellum as well as the overall cortex itself. And we can see that the light therapy significantly improved the functionality of the cerebellum. And here we can see that there is a significant increase in the overall functioning of the cortex by showing the diminished. On the left, you've got the almost entirely red, which means that it's significantly overactive. And there you're seeing a significant global diminishing of that overactivity and moving more toward normal. And these are measurements that are Z-score measurements. So these are looking at the overall comparison to the norms. And we're seeing that as the colors diminish and become closer to green, that's when we start to see that there's a greater normalization of overall cortical activity happening. And this is just after 28 days of 12 minutes a day of exposure to the 1068 nanometer light.
That's really something. These are some great images. It's a lot more detailed than the uniplanar images that you've been looking at for your career. So this is a great advancement. And also seeing the different ways and the different areas, the different perspective on what the light is doing.
Yeah, this is in a sense, it's an approximation of what a diffusion tensor imaging report would give, but this is not an exact analog to diffusion tensor imaging, but it's showing the pathways and the projections of the different networks and how they are changing as a result of whatever intervention we would be delivering. And in this case, it was the photobiomodulation.
Now, your office is really, and Baylor Scott is currently continuing a research project. You're still looking for subjects with, well, what exactly are the
early to mid-stage dementia. And so we've got a few more openings in Texas and in Pennsylvania. The current situation being what it is, we had to suspend the study until we can then safely have people coming back to the clinic.
Gotcha. But you're doing this. This is part of the protocols you're using in your active research project that you're doing right now.
Oh yeah, and this is an example of one patient that we worked with over a course of 8 years who came in with a fairly advanced diagnosis of dementia, probable Alzheimer's, and in 2011, and she was extremely withdrawn and aggressive, and her husband was having a really hard time being able to manage her at home. We started to work with her in 2012 and started to do brainwave biofeedback and also a course of the infrared helmet. She improved some and then became hard to manage again and withdrew from treatment. She came back after she started a course of functional medicine because they found that she had elevated levels of heavy metals and also mold and possible Lyme disease. So when the functional medicine treatment helped to reduce some of those problems, she was interested and able to come back and start neurofeedback and photobiomodulation again. And so we started combining neurofeedback and photobiomodulation in 2014. She was then able to take an 800-mile motorcycle ride with her husband, which she had not been able to do for the 3 years previous. Her facial expression still shows that, she's still compromised in large measure emotionally. But in 2015, after another year of treatment, they did the same trip again, and she had a much better time and was able to be much more engaged with the process and had a much better time. In 2016 and 2017, you can see that she continues to improve. And then in the next slide, in 2018, we can see that she's doing even better and able to communicate with her husband and say that she loves him and be affectionate and able to be maintained at home without any aggression, without any hostility, without any difficulty, and enjoying her life and enjoying being with other people. And there's been no use of any protease inhibitors or other psychiatric medications since we started treatment in 2012.
I mean, the affect, the positiveness, the quality of life, it just came back. You could just see it when you look at them. It was a healing.
It's been remarkable and very satisfying to see this, and it also speaks to the possibility that exists when people recognize that neurodegeneration is a systemic disorder that can be addressed and reversed if people understand what the underlying factors are that's causing the inflammation or the lack of blood flow, and then address those problems directly. This is just describing the process, the particulars of the study that we're doing in collaboration with Baylor Scott and White and the Department of Neurosurgery through what is referred to there as the Baylor Research Institute. And
well, how close are you? These people are doing twice daily, but before we had the pandemic, how close were you to completion?
We've got 9 more slots to complete, and we'll reach our cohort of 40 people once we get the other 9 subjects. And I think that the group in Texas is pretty close to completion. They're probably mid-50s, if not complete. So I added this slide just to get people to pay attention to the fact that photobiomodulation has the potential for being an effective intervention in the COVID-19 pandemic. So what we see is that photobiomodulation functions as an antiviral in terms of inhibiting the activity of furin and the preventing of the attachment and the infection. And evidence really is in seeing that UVB upregulates furin, causing toxicity, and near-infrared inhibits that toxicity. So if we can use the photobiomodulation to inhibit the activity of the furin, that's going to make a big difference. Also, there's evidence that near-infrared elevates the inducible nitric oxide synthase and in the lymphocytes, and that's also going to inhibit the UVB toxicity that we have to also concern ourselves with. The acute pro-inflammatory activity is also inhibited by the photobiomodulation, which has a direct effect on the innate immune system to combat the virus. And we've seen this with evidence in the skin, and Professor Chazot can comment more extensively on all of these factors. The anti-inflammatory is really to protect host cells in the long term, and the evidence again is in the skin and maintaining the mitochondrial health for the host cells in the long term. And again, there's plenty of evidence for this in the literature in many different types of cells.
I'm with you. Thank you, Doc. Thank you for that. Let's go here. So it took us on a nice trip through your clinical research and the research that you're doing now at Baylor Scott White and there in Pennsylvania. The thing that I asked the people at the end of the conference is, you've had 20-some years working on this, 25 years. What do you see as the future? How do you see it? What are we going to be talking about at the 2030 Brain and Transcranial Photobiomodulation Summit?
Well, our work at this point is about integrating a number of different intervention strategies and using normative measurements like heart rate variability and real-time quantitative EEG as a kind of two-dimensional guidance system, and that guidance system can then control the turning on and off of different stimulation devices, so that what we're doing is delivering a treatment both in the clinic and possibly even at home, which will automatically sense what kind of stimulation is needed in order to further normalize overall CNS activity. And that we are looking at developing that technology so that it can be delivered safely and reliably using a kind of cloud-based model for recording the data that people are putting out and then helping to support and improve a constantly improving level of accuracy for the controlling of the outputs. So that's what we think we'll see in the future, are devices that are going to much more accurately provide just enough stimulation to facilitate the body's own ability to correct itself.
I like it. Like it. Well, I'm good with that. I'm good with that. That's a positive.
Oh, great.
That's a positive outcome. Thank you, Doc. Thank you so much for your time and expertise and all the work that you're doing.
Thank you.